Welcome back to Calm in the Chair, your dental fear solution. I am your host, Dr. Vincent Monticciolo. Today we will be discussing our number one patient group that seeks out our moderate dental IV sedation, and that would be dental and needle phobics. However, before I get started, I just wanted to mention we had two recent hurricanes here in the Tampa Bay area. We wanted to send out our thoughts and prayers to all those that have been affected. Some of our staff, some of our patients have been a little less fortunate than we were and have had some devastation. So obviously we're sending our prayers to them. I also wanted to thank a lot of our employees and staff that have helped get us back up and running in most of our locations. So we are available to serve our patients. So thank you to them. So getting back, we are going to focus on dental and needle phobics, which, like I said, is a large demographic of our sedation practice. So first of all, we'll start by defining it. Dental phobia would be an intense fear of visiting the dentist or an avoidance of dental care, whereas needle phobia would be more of an extreme fear of injections or needles, but that also intersects with dental phobia. So both of them together obviously is a large patient group. And to be honest with you, I don't think anybody really enjoys going to the dentist and having root canals or extractions or wisdom teeth or things of that sort. So there is some anxiety there with almost all patients. However, the ones we're going to focus on today is the extreme anxiety and fear that prevents these patients from showing up in a typical dental office. Studies estimate that this is about 15 to 20% of our population, with about 25% of patients being afraid of the needle of some sort or needle sensitivity. Some of those symptoms will include obviously fear, but anxiety, sweating, increased heart rate, difficulty sleeping the night before an appointment, and obviously, canceling lots of appointments before they actually make the trip in. The psychological impact, a lot of these patients avoid the necessary dental care for years, obviously leading to worse oral health, pain, infections, abscesses, and a diminished quality of life or even self-image due to their smiles. What are some of the causes of this dental or needle phobic? I would say the number one cause is past negative experiences that they've had, obviously, in the past, painful or traumatic childhood dental procedures, if they weren't numb or were strapped down to have their dentistry done. Obviously, this will bring back plenty of nightmares, and people just once they become old enough will avoid going to the dentist. Or pain in the past. People that have had maybe wisdom teeth extracted and they got dry socket, or they weren't numb enough and they were awake for a lot of the procedures. This will obviously form some anxiety for future care. Also, something called vicarious learning, which is hearing negative stories from movies, TV shows, family, stories of bad dental experiences. This just increases the amount of fear in patients when they hear some of these stories, whether they're true or not. Some patients have a fear of loss of control, feeling vulnerable in the dentist chair, claustrophobic, having people over the top of them or in a private area like the oral cavity. Also, there's obviously the fear of pain, the anticipation that it's been so long that they might have a lot of pain involved with getting their dental work done. So they avoid it due to the fear of pain. And then, like we mentioned, the needle sensitivity. So a lot of patients are afraid of the needle. Literally, they know we're putting an IV in and they'll jump and we haven't even touched them. It's just an anticipation. For a lot of these patients, we have other things to pre-medicate the patient. Obviously, a lot of our patients we pre-medicate to come in. And what that involves is they have to have a caregiver drive them to the office. We've pre-medicated them with a special medication that the onset of action is about 45 minutes to an hour. And we have them taken an hour prior to coming in. So just as they're hitting our door, they're starting to feel happy to be there and very relaxed. Obviously, we bring them back in a wheelchair if they still have high anxiety or a high heart rate at that point. We can give them a little juice that has medicine in it that's going to further increase their sedation. We can give them a little nasal injection where it's very vascular that will increase nasal spray that will increase their sedation. And then as they start to get droopy, we can place the IV in. So it is very important that we do have the IV in place. So patients say, why even IV? Can I just take a pill? And we discussed that last time regarding oral sedation, where there really isn't a safety margin to that. The advantage to the IV is numerous. Number one being the safety. Obviously, we only use reversible drugs, so we can reverse the effects of the medications that we're giving. So having the IV line is almost instantaneous with the reversals. Number two, all the sedation that we do, it's what we call titrate to effect. So obviously, they're pre-medicated. We give them a little bit more in the IV. They start to get, sedated to a point where we're watching the monitors, and we can just titrate as the sedation goes, just giving them that ideal amount to keep everything nice and smooth. And then as we're finishing up the sedation, we can stop giving medication, and their body will burn that off, and they'll start to wake up and become more responsive and talk with us. So those are some of the bigger advantages of having that IV in place. One important thing to note is there is no needle in the arm. Obviously, when we put the IV in, they do use a small catheter needle, but then that is pulled out and it's just a sheath that's in the vein. So there is no needle in your arm for that procedure. One other anticipation that the patients have is kind of the sensory overload. So they have experienced in the past the sounds of the dental drill, which brings a lot of anxiety, the smells of the dental office or of teeth being prepared. They dislike the taste of some of the materials or impression materials if they're a gagger. They have all these past experiences, and that all just increases their anxiety and their fear and keeps them, from coming to the dentist. What are the major impacts, obviously, of dental-phobics and needle-phobics? Obviously, health is the number one issue, oral health consequences. These patients present with, advanced dental issues, dental decay, loose teeth, infections, abscesses, fractured teeth. So that is the number one concern. Obviously, the gum disease, all that bacteria is going through their system. The average patient swallows about 3,000 times a day. All those bugs and infection are going through their system, affecting, all the major organs. So that's a big one. Psychological consequences. It exacerbates their anxiety, leads to a cycle of avoidance, and then a worsening of the oral health care, maybe a worsening of the self-image, and it's just a vicious cycle. They'll go to urgent care, get an antibiotic just to hold the infections down, and then they feel it's okay and they can avoid it longer, which just increases the oral health concerns and the infections that are going on. Also, the economical impact. Obviously, patients that fear the dentist fear that they've been away for so long that the economic effect of getting it fixed is going to be large. The cost of the treatment will be larger because there's so many issues, and that becomes a big effect on the patient also. And then the embarrassment. A lot of them tell me all the time, oh, I'm so embarrassed with my mouth or this or that. I've avoided it for so long. We like to say it's a no judgment zone. I always tell our patients that it won't even be the worst mouth we see that hour, which is usually very, very true. We see a lot of bad situations with all kinds of various sedation patients. So the key is to get in while we still have some stable teeth left, can clean up the infection, get them healthy again, and get them on the right track. On our side, the biggest concern for us also is education. So if we can just get them into the office, explain the many benefits, explain that they're, the number one benefit is they're not going to remember any of it. We're able to put medications in their IV to make them very comfortable. That is a big trust issue. So we want to build that trust, that rapport with the patient, and let them understand that, this is what we do. We're the largest dental sedation provider in Florida. We do this all day, every day. I can attest to that. I've been practicing 34 years, and if it wasn't for sedation dentistry, I'd be retired now. It really is my passion. I enjoy doing it every day. I enjoy treating what I call the underdog or disadvantaged patient, whether it be dental or needle-phobics or gaggers or Alzheimer's or special needs. That really, just the gratitude that we get, the thank yous, it just really is what drives me every day. So I enjoy the sedation. So, communicating that and show them that we truly care and that we do this all day, every day, and showing them some of the testimonials of past patients that they have no recollection, they feel so much better, they can smile again, their self-image is increased, they can, get that new job because they now have teeth, whatever it may be, we want to put them back on the right track. So, that is, what we do for a living. So we want to, we're a service-based office, and we want to be able to increase, the self-image and the health of all our sedation patients, put them back on the right track. Some of the advantages that I mentioned of doing it with sedation, a lot of these patients couldn't have it done any other way. Obviously we mentioned the amnesic effect, so there's no recollection of the appointment. We do let them start to wake up at the end of the appointment. So anything that they might remember just will be us checking their bite for the temporaries, something of that sort, or the discussion with the patient after we're taking the final x-rays to make sure we didn't leave any cement or anything. One of the advantages is the majority of this work can be done in 1 or 2 appointments. So a lot of patients think they're going to, they've been away for so long, it's going to take 20 appointments. That's not true with sedation. With sedation, we can be not only very efficient, but in our practice, we have all the specialists on hand. So if you need root canals, the endodontist is there. He's sedation trained. He works with me. We have an oral surgeon there. So if we have wisdom teeth that need to be removed or implants that need to be placed, that's all done in that initial appointment where we're cleaning up their oral health. We're removing the teeth that are no longer salvageable, replacing things, getting everything healthy. If need be, taking out wisdom teeth, doing root canals, and all that can be done in 1 or 2 appointments. So it's not going to take, 6 months to complete this treatment. Also, the fear of pain. So that is a big thing that patients worry about. So another big advantage of IV sedation is we're able to put medications directly in the system. So as we do the procedure, obviously they'll have something for discomfort, but we also add something for nausea. So they'll have Zofran on hand, and that's so that they don't, have the vomiting, the nausea, upset stomach afterwards. And we'll also add something to the IV for discomfort or swelling. So patients are expecting all this, this extra swelling and pain and all that afterwards, and that's just not the case. So if you go online and check out, some of our testimonials, these patients say that, I didn't even take a pain pill. I had all my teeth removed. That is true. They might not have taken a pain pill, but we had already put some things in their system that made them very comfortable. So that is part of the procedure to make things nice and smooth and easy for the patient and to dispel a lot of the fears that they think they're going to have afterwards. Just to relate some of the stories of, typical patients. I had a patient yesterday, came in, prior athlete, built like a truck. He came with his wife. He was sweating when he sat down. His leg didn't stop shaking. He was really fearful of being in the dental office. And I told him, right from the get-go, I go, you're 3 times the size of me. I'm definitely not going to hurt you. And today we're just doing an exam, and I'm going to show you everything. We're going to explain everything, explain the advantages, and we were able to go through the process. He took the x-rays. We did intraoral camera pictures. We explained all the procedure. And once that happened, he started calming down and asking questions. I gave him a copy of my book. So if he had any other further questions that he forgot about, they're definitely in there. And we were able to get him scheduled, and we'll be able to put his mouth back together. So same condition. Unfortunately, he I don't know if he's a weightlifter or what. He's so big, he was actually clenching and grinding and breaking teeth. He hadn't been to the dentist in a long time, and a lot of these restorations were old silver amalgams that he had placed when he was young. And he said, that's the last time I was at the dentist. I wouldn't go back. They strapped me down. I felt like I felt everything. They wouldn't stop. And since then, I haven't been back. He hadn't had his teeth cleaned, and he had a lot of fractured teeth. And his wife was actually concerned more. She's the one who made the appointment. She got him in. She was with him. She was concerned more with his health, she was afraid he was going to lose his teeth if he didn't show up to the dentist. So fortunately, he will not lose his teeth. He'll have a Hollywood smile when we're done. So, that happens. That's typically every day. So dental and needle phobics are, like I said, a high proportion of our sedation patients, along with the other, special needs, gaggers, things of that. But it all leads back, to the patient that really is the underdog that doesn't see a dentist on a regular basis. That's what we're there for. So some of the key takeaways today, we'll keep this short. Number one, you're not alone. Okay. You're part of a growing population of patients that have dental fear, anxiety. We have seen a huge increase after COVID. Anxiety is higher now after hurricanes. People are just at their edge, and dentistry is, the last thing they want to have to sit through. So being sedated makes it so much more comfortable, and they don't have to remember it. Number two, not to be embarrassed. It's like I mentioned, it's a no judgment zone. That's what we're here for. That's what we do. That's all I do. That's what my practice is based on a daily basis. So we see these patients every day, and we do sedation every day. Number three, the increased health and self-image. Obviously, like I mentioned, all this bacteria that we're swallowing, there is a direct correlation between gum disease and heart disease. We want to get that cleaned up. We want to get them back onto a regular, visits to the dentist, whether that is sedated or once we get them, fixed up and over the hump, maybe it is being able to see the hygienist just with a little bit of nitrous oxide. But if they are still fearful, then definitely a lot of our patients, we sedate them just for updates, taking the updated x-rays, doing the cleaning, and any treatment that needs to be done. So you are not alone. That's what we're here for. If you need any more information, you can check us out at happydentistry.com or give us a call at 813-DENTIST. We do offer free exam and consultation. So until next time, keep smiling.